The family of a mid-state woman who died at Vanderbilt Hospital is speaking exclusively with us here at News 4. They're suing Vanderbilt after a resident mistakenly punctured an artery while the patient was recovering from a kidney infection. News 4's Edward Birch sat down with the woman's son and attorney.
Amazing woman, had an excellent spirit. She was the type of woman that was very excited about life.
Brett Kiefer's mother, Chesta Shoemaker, dedicated her life to being a nurse. She was an RN for more than 20 years.
Passion for helping people, healing, being there for people when they're down.
Shoemaker went to Vanderbilt for a kidney infection and was admitted to the ICU. Kiefer says his mom had made tremendous improvements during her stay at Vanderbilt until April 13, 2017.
A doctor had tried to place a central line and had inadvertently punctured her carotid artery. And she was under sedation at that time.
Kiefer says when the artery was punctured, it cut off circulation to her brain.
They tried to do what they could to restore blood flow to her brain, but the damage was already done.
Shoemaker was pulled off life support and died. The lawsuit claims Chesta Shoemaker was the patient of Dr. Gretchen Edwards, and that Dr. Edwards was participating in a residency program at Vanderbilt in April of 2017. It says Dr. Edwards was not experienced enough to be permitted to attempt the procedure without supervision, and that Dr. Edwards did not tell Ms. Shoemaker she was a resident.
They never made it aware to me that she was a resident, and most of all, doing this unsupervised.
The lawsuit seeks damages ranging from $15 to $30 million.
Vanderbilt is who let her be in that position, rather than have an experienced, more trained physician do something so important.
Edward Birch, News 4.
Now, we reached out to Vanderbilt for comment, but they tell us it would be inappropriate to talk about pending litigation. A resident, like the one in this case, is a qualified physician who holds an MD degree and practices in a hospital or clinic, usually under supervision of a senior physician.